Nurse practitioners, or NPs, are registered nurses with advanced education and clinical training. They provide a wide range of healthcare services, including diagnosing and treating illnesses, managing chronic conditions, and promoting wellness. NPs play a crucial role in expanding access to care, especially in underserved areas. They often serve as primary care providers, delivering comprehensive and patient-centered care. Their advanced education equips them to handle complex medical cases and provide high-quality care. NPs are essential members of the healthcare team, working collaboratively with physicians and other providers. Their role continues to evolve, driven by increasing demand for accessible and affordable healthcare services. Regulations governing NP practice are essential for ensuring patient safety and quality care. These regulations vary from state to state, creating a complex patchwork of laws. They establish standards for education, licensure, and scope of practice. By defining the scope of practice, regulations ensure that NPs practice within their areas of expertise. These regulations also outline requirements for collaboration or supervision by physicians. Oversight mechanisms help ensure safe and appropriate care delivery. Ultimately, the goal of NP regulations is to protect the public and maintain the integrity of the healthcare system. NP practice authority refers to the legal scope of practice permitted in a particular state. States are categorized into three main categories: full practice, reduced practice, and restricted practice. Full practice authority allows NPs to practice independently, providing the full range of services they are educated and trained to perform. They can diagnose and treat illnesses, order and interpret tests, and prescribe medications, including controlled substances, without physician oversight. Reduced practice states place some limitations on NP practice, often requiring collaboration or supervision for certain activities, such as prescribing controlled substances. This means NPs in these states may need a physician's approval for certain aspects of care. Restricted practice states impose the most significant limitations, requiring NPs to work under the direct supervision of a physician. This limits their ability to practice independently and can create barriers to accessing care. Prescriptive authority is a crucial aspect of NP practice, enabling them to provide comprehensive care. The extent of prescriptive authority varies widely depending on state regulations. Some states grant NPs full prescriptive authority, meaning they can prescribe any medication, including controlled substances, independently. This allows for greater autonomy and efficiency in managing patient care. Other states may require collaboration with the physician or limit the types of medications NPs can prescribe. For instance, some states may restrict the prescription of certain controlled substances. NPs who prescribe controlled substances must also comply with federal regulations, including obtaining a Drug Enforcement Administration registration. This registration allows them to prescribe controlled medications legally. Collaboration and supervision requirements for nurse practitioners vary significantly from state to state. These requirements ensure patient safety and quality care by fostering communication and teamwork. Some states require a collaborative agreement with a physician. This impacts patient access to care, especially in rural areas with physician shortages. Section 6. Access to care. How state regulations shape healthcare landscapes. State regulations governing nurse practitioner practice have a profound impact on access to care, especially in rural and underserved communities. States with more restrictive regulations often face greater challenges in meeting healthcare needs. In states with full practice authority, nurse practitioners can establish independent practices and provide a wider range of services. This increased availability of providers can help alleviate healthcare disparities and improve access for underserved populations. Conversely, restrictive regulations can exacerbate healthcare shortages. When nurse practitioners are unable to practice to the full extent of their training, it limits the healthcare workforce and creates barriers to timely and affordable care. Policymakers must consider the impact of nurse practitioner regulations on healthcare access and strive for a balance between ensuring patient safety and expanding access to quality care. Trends and transformations in nurse practitioner practice laws. The landscape of nurse practitioner practice laws is constantly evolving. One trend is expanding nurse practitioner scope of practice. Many states have enacted legislation granting full practice authority. Telehealth use is increasing, allowing remote care. The COVID-19 pandemic highlighted their vital role in healthcare. Section 8. Shaping the future. Key takeaways and projections. Nurse practitioners will play an increasingly crucial role in ensuring access to quality care. Understanding practice regulations is essential for healthcare providers and policymakers. Clear regulations protect patient safety while maximizing nurse practitioner scope of practice. Balancing oversight and autonomy fosters an effective healthcare workforce. We can anticipate efforts to expand nurse practitioner practice authority. Nurse practitioners are well positioned to lead innovative healthcare solutions. Embracing evidence-based policies and collaboration creates an effective healthcare system. Thank you for joining us on this journey through the evolving landscape of nurse practitioner practice laws and regulations. Your engagement and support are crucial as we continue to explore these vital topics. Please like, comment, and subscribe for more insightful content on nurse practitioner practice laws and regulations. Your support helps us create more valuable videos for you. Share your thoughts and experiences in the comments below. Remember, staying informed is the first step towards making a difference. Let's work together to shape a better future for nurse practitioners and the patients they serve. Until next time, stay empowered and stay informed. Thank you for watching, and we look forward to bringing you more educational content soon. Together, we can make a significant impact in the healthcare community.